Hi, this is Dr. Bob Dannenhoffer with another of our Facebook Live updates. I'm sporting the newest look in balaclavas today. These actually are kind of nice, and I find them to be the best way to have a mask at all times. But I'm going to take it down because we do have some people who read lips. So anyway, again, Dr. Bob Dannenhoffer, the public health officer from Douglas County, and I'll be taking your calls and your questions through the night. So if you go on Facebook Live in the comments section, leave comments and we'll do it. We don't always get to every question because some questions we've answered several times before, and then I'll get those later tonight. So we're going to answer new questions when they come up. So I usually start this off with an update of what's happening in the world. And what's happening in the world in coronavirus is still very worrisome. The number of cases and the number of deaths is rapidly increasing through the world. Although in the last week there are little glimmers of hope. In Italy and in Spain and in France, they're seeing a leveling off of the death rates and a decline in the number of new cases. That's very good news because for these last 6 weeks, Italy has had just a terrible time with very high death rates. We're starting to see in other places, for example, in New York City, we're starting to see a decrease in the number of new cases and the number of new deaths, although throughout the rest of the country, there's still a lot of disease. Especially we're starting to see big outbreaks in South Dakota. And in South Dakota is a pretty rural state, but in South Dakota there's a Smithfield plant, and this Smithfield meat plant now has over 500 cases there. And we're worried this is going to kind of seed the Midwest and cause lots of disease there. In addition, we're starting to see a rapid increase in cases in Georgia and Florida. And so a real worry that we really don't have this disease under control in many parts of the country. The good news is on the West Coast, it's pretty quiet. We're still seeing a bunch of new cases, but not an increasing number of new cases. In fact, in Oregon, the overall trend is perhaps slightly downward in terms of what we're seeing. In Douglas County, we've had no new cases now for the last couple of days. We remain at 23 total cases. Of those 23, 10 have fully recovered, which is good. So there's only 13 active cases. There's still 2 in the hospital. 5 were at one point in their illness hospitalized, and 2 remain hospitalized at this time. Thank God we've had no deaths, although we worry that this could certainly happen at any time. We've gotten some comments over the time, so let me take those first, and then we'll go back and look at the other ones. The first one was about restrictions. And to paraphrase the question, they said, United States has the most stringent restrictions, and yet we've seen the most cases. How does that square? So I looked today and looked that up. And the Oxford University in England did a study of the various strength of restrictions in different countries. And so the toughest restrictions are places like Italy, where you can't go out to do anything. In fact, some lady got arrested the other day for walking her turtle because she was out, and walking a turtle, I guess, is not one of the reasons you're allowed to be out. And so Italy has done really very strict lockdowns. China did incredibly strict lockdowns where people were only allowed out of their house 30 minutes a week to go ahead and get things. So those are the strictest. The restrictions in the United States are not strong in comparison, and the ones in Oregon are much less than other places in the U.S. So back in New York, for example, where I grew up, you're not allowed out except for essential things. In Oregon, you can pretty much go out. There's no travel restrictions. In many other places, all stores except for drugstores and groceries are closed. Here, many stores are open. And in fact, I went by Lowe's today, and there are a lot of people in the parking lot there. And restaurants here are open for takeout, not for sit down, but for takeout. And so the restrictions in Oregon are considerably less than in New York, which are considerably less than the restrictions elsewhere. So the restrictions in Oregon are not the strictest anywhere. In fact, they're relatively lenient. And the question is, do restrictions help? And I think they really do. I think the data from China, from Korea, from Italy has been that it takes a while, maybe 4 to 6 weeks of restrictions to see a big change. But restrictions really do seem to work. If you do modeling, they seem to work. By experience, they seem to work. And places we know where they haven't done restrictions actually have continued to have outbreaks. So I think the story on restrictions are that the restrictions we have here are not particularly strict, and they do seem to work. The second question is, okay, let's compare this now. We're all worried about this. We've closed down the economy. We spent trillions of dollars. We have all these people unemployed. And yet the number of people who have died so far in the 30,000 range is about what we see from deaths every year from murders is about what we see from deaths every year from accidents, is about what we see every year in deaths from motor vehicle crashes. So why are we turning our lives totally upside down about this one when we don't do it about those other things, or about the annual flu, where maybe even more people die every year than 30,000? And I think there's some answers to those questions. One is, we do care a lot about motor vehicle accidents. I mean, your car has thousands of dollars worth of safety equipment there to decrease their chance of an accident: airbags, warning systems, seat belts. And we have whole police forces who stop people on the highways from driving fast or driving recklessly to stop that. We have a whole insurance system to deal with auto accidents when they occur. So we do care a lot about auto accidents, and we do the things we can do to try and stop them. Now, yes, if we had stopped all traffic, we could stop all accidents, but you'd have to stop all traffic for all times, and that is not particularly reasonable. When we look at the flu, we do worry about the flu. I mean, a lot of people die every year of the flu, and the people who have the flu is a bad illness. So anybody who's followed the things we've done, our public health network has been incredibly involved in flu for many years. We've been doing these drive-in flu clinics all through the winters. We are always cajoling people to get flu vaccines. But flu is a little different in that there is a good test for the flu. There's no test for COVID. There are some people who have baseline immunity to the flu. There's no one who has baseline immunity to COVID. There's an effective vaccine for the flu, none for COVID. And there's effective treatment for the flu, like Tamiflu, none for COVID. So for all those reasons, we worry a lot more about COVID, because COVID could increase so much faster. So when I look at how fast the cases of flu increase in a year, the fastest it ever increases is 3 weeks. What we doubles in 3 weeks. What we've seen with COVID is it can double in 3 days. And since nobody's got immunity, left unchecked, this could have a huge death rate. This could cause hundreds or thousands of deaths in Douglas County. And that's why we worry about it more. And there's something we can do. So the something we can do for COVID is these restrictions. So I think these restrictions are logical given the risk here. And what we're hoping is that we're going to, again, flatten the curve, that Oregon's going to wind up with no more than 2,000 or 3,000 active cases at a time, which will still be a big problem, but it won't be the overwhelming problem like they saw in Italy, like the overwhelming problem we saw in New York. So that's what we got. Okay, so it's given us time to get some questions, and we'll see. So I'll bet I know what these questions are going to say. So in my opinion, so in your opinion, will restrictions on city parks be lifted by the end of April? So I do not think these are going to be lifted by the end of April, but I think in May and June we are going to see some lifting of restrictions. And again, I cannot predict what they're going to be or where they're going to be, but I've looked carefully at the president's plan. I'm working with the governor and her medical advisory panel on the Oregon plan. And I think they're actually not very far apart. And so I think we may start to see some relaxation of restrictions. I think the places we'll see relaxation of restrictions first are places that haven't a lot of cases, but have had a lot of testing, which actually is like Douglas County or Jackson County. In places where you can enforce social distancing. Little League's a little tough one because you do have to get pretty close with the catcher and the umpire and whatever. So I'm not sure that's gonna open up. But I think parks to open up for small groups and small family picnics, that could happen. Again, when it's going to happen, I can't tell you. The feds, so the president's plan had a bunch of what they call gates that we need to do. And the gates need to be a decrease in the number of cases, adequate testing, and then ability to trace contacts. So we'll go over that in more a little bit detail later, but I don't think Oregon is quite there yet. I don't think really anybody's there yet. So are any of today's results from this week's testing? Kim, this is the best. This is also good news for the day. You know, in the past, I've sat here and just bemoaned the fact that we do these tests and sometimes take 6, 8, 10 days to come back. And it's so frustrating because these are really hard to follow up when they're that late. The good news is on Tuesday, we did like 30 some odd tests and all but 4 are back. And all of the ones before that are back. So all the ones from Reedsport last Saturday, they're all back. So our turnaround time, which at one point had been 6 or 8 or 10 or even longer days, is now looking to be 2 or 3 days. That is so critically important. Nobody who has this test done wants to wait 2 weeks for the results. So we're down to 2 or 3 days, and this has been one of the best things this week. So why is Mercy short on PPE with no cases, Bruce asks. Well, the PPE story is a twofold story. One is some places that have had a lot of cases have used a lot of protective equipment for those cases. Mercy's not had a lot of cases. Although they've had a bunch of people with pneumonia, and you use PPE for anybody with pneumonia, even as it's not COVID. But the biggest problem for most places is that personal protective equipment is mostly one-use disposable. This one-use disposable stuff is made mostly in China. And starting in about mid-January, when China had their big increase in COVID cases, they both closed their factories and used up all the PPE that was in the pipeline for themselves. And so the places like Mercy have really had very little replenishment of their supplies since January. And like most businesses, they have a month or two of supplies on hand. And since they've not been able to be replenished since January or maybe early February, they've really gone all these months living off what's in the warehouse. And that's how they get short on supplies. So I think Mercy's done a remarkably good job of conserving. They've done a remarkably good job of finding other sources for it. But when, like any of us in business, if you're counting on your raw materials and they don't arrive for 2 months, you're going to run out. I mean, if you were a bakery and flour deliveries were stopped, you wouldn't take very long to run out of flour. So can you explain herd immunity? Yeah, so Amy asks, so herd immunity means if enough people are immune to a disease, it's not going to spread among that population. So, I mean, this comes from animals, where if a lot of animals in a herd are immune to something else or to some disease, if that disease comes in, it'll affect a few in the herd, but it won't spread widely through the herd. So we talk about that in people. I just don't like to talk to people about herds, so we call them as community immunity. So let's take a disease like measles. We know that measles is pretty contagious, and so that one person can infect up to 15 people. Well, we know that in the average day, you might have 20 or 30 contacts, and so that if everybody you came into was immune, it wouldn't spread very far. Now, if only half of those were immune, you'd spread to a bunch of people, and this could now spread. So herd immunity is dependent upon how contagious this is. You need to have about 85% of the people immune to this disease to prevent it from widely spreading. There's going to be a little video this weekend that'll explain all that stuff. But you'd have to have about 85% of the people immune to prevent this from spreading. We don't think we're anywhere near that. So they did a study in Los Angeles where they looked at the community immunity was 1%. They looked at one in Germany where they had the very highest group of infection. They thought this was a small community where it seemed like everybody was sick with it, and only 14% had immunity. So I would think in Oregon, where it's not been widely spread, where we've not had a lot of positives among people who are sick, I don't think our herd immunity is going to be very high, and I don't think we can rely on that to prevent this from stopping. Now, when we get a vaccine, and if we can get 80 or 90% of the people immunized with the vaccine, and the vaccine is 90% effective, that will give us enough herd immunity for this to stop. Now, flu is one that does work on herd immunity, because there are people who are already immune to flu because they've had one in the past, and then enough people get it through the year that you build up enough herd immunity, and that's the reason flu goes away in the springtime. But we're not close to having enough herd immunity for this to go away. So that's a great question. So any new cases? So the good news is no new cases over the last 2 days. We still had 23 cases with 10 recoveries, so 13 active cases. And interestingly, on all these cases, we deeply interview them and tried to find out when their first symptoms were. All of these people had their symptoms starting in March. So we've yet to have anybody whose symptoms started in April. So knock on wood, a little bit more good news. So do you anticipate the gradual reopening, or will we consider small social gatherings in homes, Florence asks. So while not revealing the secrets that I know from being on this medical advisory panel, which really aren't any, but it's the data, I think what we're going to look at is we're going to look at the risk of certain things. So like, what is the risk of being at a park where we enforce social distancing? So family groups can come in the park, everybody else is more than 10 feet away. The risk on that's pretty small. What's the risk of a packed church service? It's actually moderate, because you're spending an hour and a half with lots of people. You may not know the people you're around, so I would say that's moderate. And then the Blazers game, which we talked about in the beginning here, and about how dangerous that would be high risk. So likely what would happen is you'll start low-risk activities first and then move up. How specifically we do that, I don't know. The president's plan called for gatherings of up to 10, I think in phase 2. So that, that could happen sometime this summer. So do you foresee the COVID-19 future vaccination be required for school? Again, Leslie asked this question. I don't really know. You would think it might be. I would think, however, like with these things that cause pandemics, you would try and vaccinate everybody at once, and it wouldn't be specific for school entry. Now, depending on how long these vaccines last, you might need boosters, and I'm not sure how young you could actually do it. Remember, kids, although they seem to get this disease just like anyone else, they almost never seem to get sick from it. So I don't know what's going to be there. So why don't they just wear cloth gowns and just wash them? Veronica asks. So this was a great question. So 20 years ago or 30 years ago when I started, everything in the hospital was washable. In fact, we even had washable masks. I can remember back on the things on MASH, we had rewashable masks and rewashable everything else. And so that's what we did. We washed everything. And until about 15 years ago, that was kind of the standard. And then started to get the single-use stuff. Started with masks and then went to caps and then went to gowns. And then got to the point where everything was one use and throw it away. And so the hospital got rid of all of their reusable stuff and then wound up with problems. Over the last couple of weeks, they've recognized this, and they've actually had a local area in town make them a bunch of gowns and a bunch of disposable caps and whatever, and that's what they're doing. So Veronica, you got it. So at the daily press conference, Oregon was identified as one of the states that don't have enough testing. Why is that? I think that's not correct. So Oregon actually has a lot of testing. So I'd have to see whose press conference. Bruce, if you could write in and tell me whose press conference that was. Actually, Oregon has a lot of testing. So again, we look at the testing in, it's a weird number, but tests per 100,000. So in Douglas County, for example, we have over 600 tests and about 100,000 people. So we have about 600 tests per 582 tests or something per 100,000. So that's actually a relatively high number. And the number really to look at is a percent positive rate. So throughout the country, the positive rate throughout the country is about 20%. That's horrifyingly high. Our positive rate is only 3 or 4%. So I think we're doing okay with testing. Do we need more? Yes, really this test should be like a strep test or like a flu test. You shouldn't have to drive to the fairgrounds twice a week. Every doctor should be able to do it in his office. But to do that, we need enough of the swabs, not enough of them. We need enough of the viral transport media, not enough of it. We need enough PPE so the doctor, when he does your swab, can be protected so he won't get it when you cough in his face. And so we're lacking the tests, we're lacking the swabs, we're lacking the viral transport media, we're lacking the PPE, and right now we've got good enough turnaround time, but if the testing increases, we're worried that the turnaround time will again increase. So you need all of those things along the way to get adequate testing, and that would be the goal, right? The goal would be that anybody who was sick would go in on the first day. I saw a tragic story today in the JAMA, and it suggested that those people in Washington who were sick worked 2 or 3 or 4 days after they were sick and brought that to the little old ladies in the nursing home, and that's how they died. Now, there's a societal reason here, right? If you are at a low-wage job and you call and you say, "We got a little sniffles, I don't want to come to work today," or "I felt achy this morning, I didn't want to come to work," your boss will say, "Well, then you're fired." And so these people worked when they were sick, and unfortunately, that's what brought it on. What we should have is that if you have any symptoms, on the first day you have symptoms, you should stay home and get tested. And you should get tested each day until you feel better or your symptoms go away. And in that way, we could actually get rid of this. So do any of the people who contracted COVID know each other, Nancy asks. Well, so of the cases, now that we're getting more cases, we're beginning to see the connections between these. Some of these are family connections, and presumably they know each other. And some of the people in the family who have this aren't very sick. So one of the cases that was identified this week was already recovered by the time she knew about it. So yes, some of those people know each other because in the family. Some of the people are in work areas. So there are 2 companies or 2 workplaces in Douglas County where there have been outbreaks, and those people kind of knew each other. So yes, they do. But other than that, these are otherwise pretty much spread out. So today's Trump press conference, not testing, but test capacity in local labs and hospitals. Yeah, I'll have to watch the press conference. I don't exactly. So, the local labs and hospitals, Oregon only has big hospitals with big labs in Portland. So much of the rest of the state has to send their labs to them, and that may be what they're talking about, but I'll have to look at that today. So why does Douglas County have so many cases? So almost half of Lane County when they have a more dense population. So the story is we look at cases per million, and again, it's a different denominator here. And the cases per million are about 42 cases per million in Oregon. So we have, so if you look at the numbers here, we actually have fewer than the numbers. So to get the numbers here, we usually have about 4% of the state total. So 4% of the state total would be 68 cases, and we only have 23. So we actually have fewer than that. Lane County actually has a low number of cases. We don't exactly know why. It may be because their population is a little bit bolstered by the university, which is closed since then, and many of the patients have left. But Lane County has a smaller number than we think, and Coos County has a peculiarly small number. We don't think it's because they did anything different. Actually, our testing numbers in all these areas is really quite similar. So how do you get tested if you don't have a primary care doctor? So the first thing I would really say is get a primary care doctor. This summer, when the new primary care residency opens at Aviva, please, please, please get a primary care doctor. I think if there are some things in life you really want, you want to have a great wife, you want to have great kids, but you should also have a great doctor. And I've always in my life had a great doctor. And so that's one of the things I would have you get. So when that opens, please get one. Well, that's not till July. In the meantime, we work with the people at Evergreen. And if you're sick, they have a respiratory clinic, they'll see you. And if you need to get a test, they'll send you for the test. So should people in high-risk groups avoid places once the state starts to open back up? Laura asks. Yes. So again, if you look at the plan that the president put out yesterday, high-risk individuals should not leave their houses really until phase 2, which is going to be a long way off. And so yes, people in high-risk groups really, really should stay home as long as you can. Yeah. So Shirley asks, is there any way that you can get people to stop dumping animals because they think they're contagious? I'll plead as best I can. I don't. They may not be listening to me tonight, but please don't get rid of your animals. Your animals at this point can be such a source of comfort, and we do not think in any cases that they've been a source of infection. So no reason to get rid of your animals. All right, so another question. Serena asks, do you think there will be a surge of cases in 2 weeks because of a lot of people gathering at Easter? Well, we'll see. And actually, that's one of the big concerns that we have as we start to open things up and people start to have gatherings. Are we going to start to see an increase in cases? And we might. So this is my time that I will plead that if you are sick, please stay home. If you were sick enough to get tested, please stay home until you get your test results back or until you're all better, whichever is longer. So tragically, we had somebody who was sick. They got tested. They were still sick. They went to an Easter thing with a bunch of other people, and then their test came back positive. Please, if you're sick enough to get a test, please, please, please stay home. That's going to be the way we're going to go ahead and defeat this thing. So yes, we might see some cases secondary to that. Now, one of the things that's most peculiar about this disease is there are some people who don't seem to spread it to anybody. So we've had cases where even the people in their family don't get it, and then other cases where it spreads like wildfire. So for example, on this Teddy Roosevelt aircraft carrier, it just spread very quickly, or in this Smithfield meat plant in South Dakota, it spread very rapidly. And then other places get one case and then it just dies there. So we don't know. So will there be a surge after Easter? Could be. So please, 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 if you are sick, stay home. So is it okay to get together with a couple of close friends. Well, so the story is right now the recommendation would be not. I think when we open things up, small family or small social gatherings will help. But you'll see that, let's say you have it, don't even know you have it, but your symptom, and you're before your symptoms, but you're contagious. And then you go with your friends and you do the kind of things that friends do. You get close, you share drinks, you hug maybe, and do those kind of things. And then you give it to them. Then this is how this spreads. So I think right now the recommendation is still not quite yet, but soon, I hope. So Kathy says, my husband takes lisinopril. Is he at higher risk or danger? So lisinopril is a high blood pressure medicine. It's for other things too, but it's mostly for high blood pressure, and it's called an ACE inhibitor, which is angiotensin converting enzyme inhibitor. And the reason this is of some interest is that this virus seems to get into your body by attaching to the angiotensin converting enzyme 2 site. So there's a site in the bottom of your lungs that where this ACE is, and the lisinopril is an inhibitor to that, and there's a concern that as an inhibitor of that you might be a little bit more prone to infection. This is a really important thing because a lot of people take ACE inhibitors or angiotensin receptor blockers, and so this is going to be one of those things we're going to definitely look at. The initial data suggests there's no increased risk. And the American College of Cardiology came out this week and saying, look, if you're taking lisinopril, don't stop because there's no sign yet that it's a risk. But clearly this is going to be an area where people want to know. So the question is, antibody testing available here yet? It is not available here yet. The one company that can sell it, which is Henry Schein, hasn't shipped yet. So again, 3 weeks ago it was, antibody testing is going to be here anytime, and it is apparently not. Now, there are a bunch of companies that are making these antibody tests that have not yet been approved. So I saw a few news stories today about people doing antibody testing at Major League Baseball and United and Emirates Airlines and other people doing it. But these are not yet shipping from Henry Schein, which is the company. Now, there is good news on the antibody testing, is that Providence does have an antibody test, which is going to get approved. And they did a study looking at the population in Portland to see how many of these people actually had this disease in December or January. And I was told it would come out today. Still don't know. So there's a study in Wuhan that showed that some people have neurologic symptoms first. Has this been seen elsewhere? This is very interesting because as more and more of these diseases are there, you start to see weird symptoms. So in the beginning, we thought this was pretty much fever and cough. That's it. But then we had fever and cough. Then we heard that some people just had diarrhea. Then we heard that some people just had a loss of smell. Then we said that some people had red around their eyes. Then we said that some people have these funny purple spots around their toenails. Who knows what that means? And then we hear this week that there are some people whose first signs of this are delirium. And delirium is this sort of sense of being kind of out of your mind, like you get sometimes with a high fever, although these people didn't have much fever, or like you get sometimes with an intoxication. So I think what we're learning now is that this virus attacks many parts of the body, and that looking for just the fever and cough is not a good way to do it. Another study that came out today, that's really all I did today was read. Another study that came out today from Seattle showed that if you looked at people who were workers who were sick, so worked in this nursing home and were sick, that was where it said that people went to work sick. But many of the times people didn't have the classic fever and cough. They had myalgias. Backache is a weird one that people seem to have. Some people had a runny nose. Some people had a sore throat. Some people just felt bad. And so they just had this sense of impending doom that just didn't feel right. And so that to really look for this, to rule out somebody from being infected, you had to ask like 12 questions. So there were some people who were totally asymptomatic, and even all the 12 questions wouldn't do it. But to find all the symptoms, you'd have to ask for fever, cough, diarrhea, sore throat, runny nose, myalgias, chills, change in your sensorium, which would go along with the delirium, rash on your feet, redness around your eyes. So there's a lot of questions to ask along the way. And by the time you get to that many questions, almost all of us may have had one of those things in the last few months. It's like, yeah, I did have this funny thing on my feet, but then it turned out about athlete's foot, or I did have this backache because I was lifting too much lumber. So it's going to get really hard because this virus is not anybody says there's sort of the typical presentation. There is no typical presentation. So when do you think the YMCA can open back up again? Well, as you know, I'm a big YMCA supporter, and I went there almost every day in the year. And this has been one of the two biggest things I've missed with all of this. So it'll be the YMCA in all gyms, so the YMCA won't get any special dispensation. In the President's plan, and I think similarly in the Oregon plan, in phase one, places like gyms can open up with adequate social distancing. And again, adequate social distancing is 6 feet. The Canadians have a good one. You know, they play hockey all the time, and so they use a hockey stick. So if you carry a hockey stick and you can touch anybody else, then you're too close. That's a good way to think about it. But yeah, gyms might be able to open up with adequate social distancing. So, for example, in the swimming pool, if you swim one to a lane, you are by definition 6 feet apart, and you should be at low risk. You could imagine working out on a machine 6 feet away from somebody else. So it may be there. So for people with pulmonary fibrosis, do you think it's safe for them to be out without a mask? Yeah, pulmonary fibrosis is a terrible disease. We have no clue what really causes pulmonary fibrosis. Basically, if you think about the normal lungs are super duper squishy, like the softest sponge you've ever seen. With pulmonary fibrosis, they sort of get harder and harder and harder, so that they get more like a Brillo pad. And so pulmonary fibrosis is a bad disease. There are not enough people with pulmonary fibrosis to know specifically about COVID, but I think that's a respiratory disorder that would put you at very high risk. So I would do as best you can to stay home. So do you think social distancing will go through the summer? I think social distancing will go until we have a vaccine. So I think until we have a vaccine, we're going to be social distancing. And because when you look at the different strategies, right? So the different strategies to prevent the disease, the most effective one is social distancing. You'll remember from my spray paint, after 6 feet, pretty much goes away. If we could really enforce social distancing, we would do pretty good. The second one is staying home when you're sick. That's going to be a hard one to do, especially with limited sick time sometimes, and with the vagueness of the symptoms with staying home. Wearing a mask can help, but I think social distancing is going to be there for a long time. Now, will we let up a little bit on social distancing and maybe allow family gatherings? Probably. But are we going to allow graduation ceremonies? I don't think so, because I think social distancing is the only thing that will work. And if you remember from the beginning, as I said, I don't think more than 10% of the people have had this, which means the rest of the 90% of us are sitting ducks if this starts to spread again. So I think social distancing actually can be part of the deal. So Cheryl asked about false negatives. So I heard that 70% tests that came back negative are false negatives. Is that true? Okay, so that is not true. So the story is that and the story is it's not the problem with the test. The test that we're using here through Quest is a real-time PCR. The one that the state lab is using is a real-time PCR. We think those tests themselves are very accurate. So if you actually, the way that you would test these is you would take a known sample of virus and you would test it, and then you would take some salt water and you'd test it, and you test them all away, and this test would perform nearly perfectly with nearly 100% sensitivity and a nearly 100% specificity. So the problem is not with the test. The problem is with how we're getting the sample. We're getting a sample from the back of the nose. And although we try really hard to get a good sample in the back of the nose, there's not very much virus there. And because there's not very much virus there, about 30% of the time when you have the disease, there won't be enough virus there for us to pick up. The only way to get more virus would be to go deep in your lungs, and we're not about to do that. And so that's the problem. The problem with the test is that there's very low levels of virus, and it's not there all the time. So this disease is very peculiar. There are people who have it, and in China they test it every day. So there are people who said, I think you got it. You're in a family with it, and they tested them and they didn't have virus 2, 3, 4 days. On the 5th day, they had it, and then it would go away within just a few days. Whereas other people had virus before they were symptomatic and continued for weeks after they were symptomatic. So we had a case where this woman symptoms were all resolved, and she had a test for a different reason, and it came back positive even though she was perfectly well. So the testing on this is not because the test is wrong, it's because this is a weird virus. People who are sick and don't have very much virus, people who are not very sick and they do have virus, and that's the problem. So it's not 70% false negatives, it's maybe 30% false negatives, and again, that's only because of the testing. So Courtney asks, what are the testing qualifications? So early on, when testing was more limited, we limited this to too much talking today. We limited it to people who were symptomatic with cough and fever. At this point, we're saying if your doctor wants to test, we'll do it. So we have enough capacity to do 45 tests on Tuesdays and Fridays and 15 on the weekends, so that if your doctor wants you to get the test, you can get it. So how big a risk factor with autoimmune diseases have? This again is another unusual one. We think that people with autoimmune diseases are at higher risk. Although when I've tried to actually find the actual data, so I actually tried to sort of pierce into the data and find out about that, it was hard to find out the specific data. And again, this disease is only affecting a small percent of the population. Only a small percent of the population have autoimmune diseases, so it was a little harder to figure out. The recommendation, though, is that people with autoimmune disease do have some risk, but I was unable to find how much risk that was. So Jessica asks the difficult question: is it true that people who are taking Epclusa have lower immune system and more at risk? Well, here is the weirdest thing: is that there are some diseases that suppress your immune system. And you would think that would be bad, because if you had a suppressed immune system, you'd think you'd be more at risk for infection. On the other, because we think like steroids, which suppress your immune system, are bad. But then other things which seem to modulate your immune system, like some of the arthritis drugs, and I'm looking up Epclusa here to see if there's any data today, might help. We do not think that, we don't know. So again, the data is just coming in. This is not a big drug in China. And again, most of the early data we had was from China. This disease in the US has just been here for 7 weeks. So the data on these kind of things is not available, but I'll look again today. What do you think about OSU doing study on people testing themselves? So yeah, as Leslie asked, so people testing themselves would be great. And you saw a study come out this week from New Jersey where they were able to test for this in spit. It's only one lab that's doing that. But boy, wouldn't it be so great if you could test people with spit rather than with that. So about 3 weeks ago, you heard that my dream was to get a little test where you put a little mouthwash solution in the morning, spit it into a cup, and then when you were done with your shower, you get out and see if you were infected. With that, we could really know what's going on. They're working on it. I mean, there are so many smart people working on this now that I think will likely have better testing. OSU actually has a long history of doing viral testing, mostly for animals, at their animal studies place. So I'm hoping for that. Yeah. So somebody says, I work in a restaurant. Should I be worried about going to work once we open back up if we can't wear a mask or social distance? Well, I think the answer on this is that restaurants may be able to open up if they can socially distance. So, I know normally waiters and waitresses come right over to the table. They sort of stand over you. You can't really protect yourself. But you could imagine doing ordering from more than 6 feet away. You could imagine instead of putting the plates down right in front of people, you could put them on the table next door and the people would need to come and pick their own plates up. I'm not sure how this is going to work. I do not think people can survive on home cooking for that much longer. There are a lot of people who eat out a lot, eat out 2 or 3 meals a day. And I think restaurants need to open up. I think for just the vitality of our society, we have to think of a way that we can get back to restaurants opening up, bars opening up, churches opening up, because this is really what our life is about. So after you are considered recovered, are you still shedding the virus in contagious? Amy asks. And again, we don't know for sure. The best data suggests that when you are symptom-free for 3 days, that you are no longer contagious, even if you can find some of the RNA in your nose. And so RNA can stick around for a long time, and RNA can stick around, but it doesn't necessarily mean that you're infectious. So the best data so far suggests that if you're considered recovered, you are no longer contagious. So when will we get a vaccine? I hope for Christmas. That's what I'm hoping for this Christmas, a vaccine. Again, vaccines are hard to make. I heard today from somebody, I can't remember where I read this, that they have a vaccine which has been immunogenic in mice. Immunogenic mice is a good thing, but doesn't mean it'll be immunogenic in people. And so vaccines will take along. So the way vaccines work is you need to find a target that the vaccine will target. So in the old days, they used to just take the whole thing and kill it and inject it in you, but we don't do that anymore. And what they do now is they try and find the protein that your body will react against. And you have to pick the right protein. They think they have the target protein, which is called the spike, but they can't be sure until they make a vaccine for it and see if people make antibodies against it. Now, I will tell you, viruses are pretty tricky sometimes, that they figure out ways to hide the spike, and so that it looks like this should work, but something else gets in the way and makes it so that your body cannot do it. So, the hope is, again, that we were 12 to 18 months away 2 months ago, so that we would be 10 to 16 months away. Lots of people working on it. I don't know if there's going to be a lot of progress. As I've said, some viruses we can make very quickly. So you remember when the swine flu came out, that came out in like April and May. By October, we actually had a vaccine. So that was in 6 months we had a vaccine, but that was a flu vaccine that we've already made flu vaccines for other flus in the past. We've never really made a successful one against coronaviruses, so I don't know. So I'd still go with the party line, which is a year to 18 months from 2 months ago, so 10 to 16 months. But that's what I want for Christmas, so if anybody doesn't know. When do you think this is going to slow down? So I'm an incredible data nerd, so I've got this spreadsheet, which is like 50 sheets and all kinds of stuff, and every day I'm putting data in the middle of the night. So when do we think this will slow down? It's going to be very variable. So I think already in Italy it's starting to slow down. I think in New York it's starting to slow down. I think in Oregon it's pretty flat. So I look at the number of new cases every day, which is probably the best measure in Oregon. And the number of new cases per day has been between 40 and 100 for about 20 days now. So for about 20 days, we've not seen any big peaks or anything. It's been pretty flat over that time. What we haven't seen is a big decrease. So this guy was on the TV before from IHME, which is the people who do this, and they say that places shouldn't open up until you have 1 new case per million. So that would be amazing, right? Because 1 new case per million in this country would only be 300 new cases a day. We've had 30,000. And in Oregon, that would mean 4 new cases a day, and we're having 40. So I don't know. But I think this is going to slow down. I think one of the things that's very clear is people thought this would go up and go down. So you saw the word trajectory used. So trajectory is a geometric word that suggests it's a parabola that goes up and down. Like if I threw a baseball up, it would go up and come down in the same way. This is not going to be a parabola. There is not a place in the world where this hasn't gone up quickly but then come down very slowly. So it looks more like it looks more like a step rather than a trajectory. So I think probably in the next few weeks we're gonna be in the downward area. So what's the best way to use gloves? Samantha asked. Well, gloves are interesting. There are some people who say that if you use gloves incorrectly, they actually cause more harm than good. So using gloves correctly is hard. And there's actually a great video that our own Kristen did. And so I would have you watch that. And so that's a great video. I can't improve on that. So Connie says, do you feel that the state will be able to follow the plan to allow non-essential surgeries as of June 15th? The answer is this is clearly something that's being looked at carefully. There are a couple of things that stand in the way. One is adequate PPE. So non-elective or electives or non-essential surgeries, I think that's the right way to put it. Non-essential surgeries use a lot of PPE. So let's say I was going to go and have my shoulder worked on, and the orthopedist was going to do that. So there would be 6 or 8 people in the room, all of whom would have gowns and gloves and masks, and I hope they do when they went ahead and do it. And I hope they would use new ones and discard them and use a new one for the next guy. So that if they were going to do, say, 6 or 8 surgeries in a day, they might go through 50 or 60 sets of PPE. And so PPE, I think, is going to be the big limiter. We thought at one time it would be hospital beds. I don't think it's going to be that. But I think it's going to be PPE, because if the hospital blows through 50 sets of PPE in that one OR, they may not have enough for other things along the way. So I think that's going to be the limiting factor. And I don't really know, the PPE situation, as we talked about before, is both a use issue in the places that have had a lot of cases, and for everyone, a interruption of the supply chain. I really want to see that supply chain back and really working. What's happened now in the supply chain apparently is that people order things. It's coming next week, and then it gets bought away by somebody else on the dock, or somebody else intercepts it along the way. So there are a number of these stories where people's supply chain, even though they have it ordered and paid for it, it somehow doesn't arrive on the dock. And that's what we really need to get. But I think once the supply chain is back, we can do it. There's certainly a lot of people who need things to happen and haven't been able to get it because of the interruption. And I especially worry about people, for example, have cavities, right? So cavities don't get better by themselves. And so if you had a cavity back in February, you need to get it fixed, you made your appointment for the 3rd of March, and then your appointment got canceled, you may not be able to get it in June or July, and by then that cavity could be big enough that it'll cause lots more troubles. So I'm really hoping people will do that. We know that there probably been some cancer surgeries that have been delayed. We really need to get those done. We know that colonoscopies are great for finding colon cancer at a treatable stage. What I'm worried about is that by waiting 3 months or 4 months or 6 months, that some of those cancers that might have been easily treatable back then will be harder. So I really hope we can get back as soon as possible. But I think PPE is going to be the number one issue. The other is going to be nursing homes. Nursing homes are really not wanting to take new people in because they're really worried about bringing anybody in if they're asymptomatic who would turn out to have COVID and infect everybody else. So I think anybody who has a surgery that's going to need to go to rehab or to a nursing home, those are likely to be delayed too. So is there any mask that you can put in an autoclave or sterilize? So the answer is these go in the washer and they can go in the autoclave. So the handmade cloth masks can do that. They work great. It turns out that you don't need to get as high heat as you do in an autoclave. Just washing with soap and water works perfectly fine. Now the surgical masks that are made of fiber, so the manufactured ones, those actually can be sterilized in a special UV light arrangement. And actually Mercy is working with the VA to get that done. So CM asks, how can we encourage providers to conduct more testing? Seems like some providers are resistant to testing. So I don't know where the reluctance comes from. I think the reluctance comes from a few areas. So one is there are some places that don't have a lot of PPE. And so, they may have I work with this clinic up north in northern part of Oregon, and they had 10 sets of PPE. And their question is, should they continue to do testing? And the answer is I really wouldn't, because you need those 10 sets of PPE in case you have a patient who comes in sick and you need to use it for that. And if you use it all for testing, then you're going to have to close your clinic, because you have to protect your workers if somebody comes in and when they're sick. So they stop doing testing. Other clinics have stopped because they don't have any supplies, the swabs and the viral transport media. And then other people have been reluctant to do testing because we're not sure what to do with the results. So if I come in and I'm mildly ill and I've got a little cough and a little bit of fever, but otherwise doing well, if the test is positive, I should stay home until I'm better. If the test is negative, I should stay home until I'm better. And it's not clear that it makes a difference in the way you would treat me. Now, when we get to the point where we're looking to eradicate this thing from Oregon, those kind of testing will be important, because that will help us to find out where I got it from, where you got it from, and who you gave it to, so you could track it down. Right now, we're not doing that in Oregon, so that may be some of the reluctance. So, Fred asks, where do we get masks like yours? Well, these were from Amazon. My wife got these. I really like these. I can wear this. I don't have to touch my face. It works great. These are on Amazon. They were like $10 a piece. Laura asks, do the handheld UV light devices work? And the answer is I do not think so. So you have to have a lot of UV light. In fact, it has to be so much that nobody can be in the room when they're on. So I don't think the handheld ones will work. You can look, though. It's on the University of Nebraska ultraviolet light mask decontamination, and you can see. But generally, this is more ultraviolet light than is safe to be directly around. I'm seeing that the questions are coming to an end. So if we didn't get a chance to answer one of your questions, or you think of something else along the way, please put it in the chat section, and I will try and get to it tonight or this weekend when I get a few minutes. I will look up the story about Eclusa to see if there's anything there. And there's a couple of others that I'll look up along the way. Again, this is Dr. Bob Dannenhoffer. A couple of things I would remind you. Social distancing is still so important. If you're a Canadian, think of a hockey stick. If you could check somebody with your hockey stick, then you're too close. If you're an American, think of 2 arms lengths different distances. If you're a golfer, think of a putt. That's sort of your mid-range putt. So it's not. Oh, no. So it's much longer for Brian. So Brian gets much longer. So think about that. So social distancing is important. The second is if you're sick, stay home. The third is good hand washing is important. And the fourth is take really good care of yourself. The weather is starting to get nice. There's no reason not to be outside by yourself for a walk. There's no reason not to be outside going for a bike ride. There's no reason to not go out and enjoy the nice weather and the flowers that are starting to bloom. This is also time to eat nice to yourself. I've seen a couple of things where people are saying, well, this is the time that you should diet a lot and read books that you never wanted to read before. I would not recommend that. I would recommend eating well, sleeping well, enjoying friends, and doing things that you like to do, because we're going to get through this. And we get through this, if everybody's angry and upset, that won't be good. When we get through this, we should all be charitable to each other. This has been a tough time for a lot of people. The people here that are working with me work incredibly long hours. We're working nights and weekends every weekend. I'm going to be going to Reedsport tomorrow. So these people have been working like every day for the last 40 days. So people have been very kind to us, and thank you for all that. Again, this is Dr. Bob Dannenhoffer. We'll see you again on Monday.